Hello, I'm Harold Jones, Dean of the School of Health Professions at the University of Alabama at Birmingham. Thanks for joining us today for another discussion in our continuing monthly series where we interview experts in our school. These experts are leaders helping to shape the future of healthcare through tailoring innovative solutions to real-world problems. Joining us is Dr. Patrick McNeese, Associate Dean for Research and Enterprise Development for our school. Dr. McNeese combines experience and expertise in business, research, and governmental affairs, and has a long history of developing and validating the cost-effectiveness of healthcare intervention technologies and packages. Prior to coming to UAB, he served as CEO and the chief scientist at the Seattle-based firm Applied Health Sciences Incorporated for many, many years. Patrick, thank you for joining us today.
Thank you for having me.
As the first question, what I want to do before we get into discussing about the whole concept of enterprise development, I'd like to talk to you a little bit about your background. You come from a relatively unconventional background for people who are entering a position like an Associate Dean for Research. You have spent most of your career, it seems at least on paper, in the business sector. Could you tell me a little bit about those experiences, about your background, and how that relates to the position that you're currently holding here at the School of Health Professions?
I was about to take a job at the University of Georgia and won an award for some research I'd done. And the award resulted in opening the doors for a lot of consultation with business industry, as well as academic settings. From that, without any real plan, a business grew out of it. Over the years, it grew into a fair-sized business, and I sold it. Kind of reinvented myself and pulled back into more of a research mode and developed some intellectual property in that business and ended up licensing it and sold that business and started a company called Applied Health Science. Applied Health Science was a different business model. It was, rather than growing value in the business, it was set up to take intellectual property from creation to market. And so we had a number of different programs and technological systems, all related to health. So over the years, I had kind of an odd career where I was in business. I had one foot in business, another foot in an academic setting. I always had academic appointments. Then if I had a third leg, it would have been doing grant reviews for NIH and the types of things that you would do if you were in an academic setting. In my particular case, of course, that didn't work toward tenure in my business and didn't get me promoted. But nevertheless, I did the things, I published, I spoke, and I did the things that one would typically do if you were in an academic setting, and I did my own, I had my own research program. Also, over the years, it allowed me to figure out how to take something and manage it in a way that allowed it to grow, and thus the notion of an enterprise. So rather than just my program of research, it also sensitized me to the things that one needs to be attentive to that sometimes we don't think about in academic settings. For example, if you're in business and you're working with strategic partners, which I typically would do, you have to be very attentive to how that business operates, and you have to be attentive to the market in a different way. It's not just because I think something's important that's going to make it commercially viable, but rather, does the market think it's important? Am I delivering a vitamin that's going to make people better, or am I delivering an aspirin that's going to relieve some pain? And it's a lot easier to sell an aspirin to relieve pain than it is a vitamin to make people better, I found. So I started looking for where are the pain points out there. What do people need? What does the market want? Not just in a commercial sense, but where can I position what we're doing in such a way that it is actually going to make a difference in the world? To do that, yes, there are certain requirements that are necessary. And over time, I think those same requirements are ones that one can apply in an academic setting.
You have told us some about what enterprise development is in your last answer, but the title, being Associate Dean for Research and Enterprise Development, is relatively unique. Most people hear about the research piece, but not the enterprise development piece. So could you take some more time and tell us a little bit about what enterprise development means and how you would define that term?
Well, in healthcare, it's not that basic science is not important. I came out of an animal lab. It's an undergraduate even. So it's not that I don't understand the importance of basic science, bench science. But in our business, in our school, we are in the business of preparing people to make a difference in other people's lives. I mean, that's what we're about, to improve their health, to ameliorate their suffering, and to make their lives better. To do that, we can go at it in one of 2 or 3 different ways. Traditionally, I talk to my academic colleagues, and they talk about their program of research. And I have to tell them, frankly, I'm not concerned about your program of research. What I'm concerned about is, what do you know how to do? What are your skills? What's your expertise? And can we use those in such a way that you can make a difference in people's lives? That's what the research part is. The enterprise development is taking that to a different level. It's borrowing, frankly, more from business and industry, where we're more comfortable talking about enterprises or enterprise-level operations. I think the notion of an enterprise is one that is built on several different assumptions. One is we're going to approach things in a systematic way. Secondly, we're going to approach things in a systematic way where the differences that we make can be sustained, they can be delivered. Discoveries, in a sense, have, at some point, if they don't make a difference in people's lives, we ask ourselves, well, what is the real value of that discovery? And I'm not arguing again that there's not value in bench science. I am. But most of our work is ultimately leading to making a difference in someone's weight, making a difference in someone's ability in their range of motion, in their gait, in their walking, making a difference in a person with disabilities being able to function at the highest level possible. So we go around our school, we're training administrators, we're training leaders in healthcare to manage enterprises. So it seemed very natural to me when, frankly, you approached me and said, what do you think about adding enterprise development to your title because you're doing more than research? I was very comfortable with that because I think it did adequately describe what we were trying to do, at least.
Well, you've told us how enterprise development and its interaction with a university can significantly benefit society and help make a difference in the life of individuals and in our communities in general. Are there other advantages to the academic community or to an academic enterprise, per se, that comes through looking at enterprise development?
Absolutely. I focus more on the research side and of things. But if we look at academics, tailored academic programs to specific needs in the world seem to me to be something that's just as important as getting our discoveries in the hands of markets and people where it makes a difference in people's lives. Using our talent in a way that we systematically make that talent available to others that need it is also an example. So it really breaks into, one can divide it in many different ways, but there are 3 different areas. One is our research and getting discoveries into technologies or systems or services that make a difference in people's lives, but it's also tailored educational offerings, as well as beginning to think about our expertise and our talent coming together in configurable services that can be offered, grown, sustained. And of course, then there is the whole thing with intellectual property and services in a more economic sense, where, frankly, in education, it appears to me we're facing similar situations that a lot of businesses face. At one point in time, we probably, for example, was in the research portfolio, was much too dependent on NIH. Well, we were there because we're rewarded for that, basically. That has been the gold standard for how we've been judged in the past. However, it also makes us pretty vulnerable. There's a story about Sears. In the old days, there was a guy who had developed a particular type of lawnmower. Sears says, "I'll take all you got." So he started selling only to Sears. That was great. His volume went up, and then Sears pulled the plug on him. He went out of business. So if with a heavy reliance on National Institutes of Health for research funding, that's okay as long as it continues. And so what we're seeing today, of course, is the realization that we were right. It wasn't, we were vulnerable, and we began to diversify our revenue streams when it came to research. Well, that took talking to different kinds of people. It took talking to industry. It took talking to the military. It's taken different forms. But it puts you into a situation where your consumer and your partners and your strategic partners take on a very different type of focus. They're not necessarily different, but a different focus and a different way that you work with them.
Now, there are those who are research purists who believe that what a researcher should do is just follow their own creative instinct, look at the questions or the problems that they want to research. And to them, the concept of pairing with industry or business or some external group that helps define what it is they should work on or the problems that they should solve is in some way diluting that research purity. What is really the balance, as you see it, between the creative desires and interests of research faculty and the interests of society and the needs of society and business and industry, and how do those things pair up? What's the correct balance that we should be looking for in our school?
Well, to me, a healthy balance lies in being able to have a third piece. And the third piece are people that can work as the middle person in being able to translate what the world is saying about what they need and what's possible, the channel markets, and at the same time understanding the possible importance of the discoveries that are being made and serving as a bridge from one to the other. So again, the purist can be pure, but ultimately the question is going to be who's going to pay for that. And if they want to be pure in their science and in the types of questions that they're asking and what they're working on, that's fine. But ultimately, someone is going to pay for that, and the question is, who is that going to be? So it's almost like I used to think that we needed to look at the world through a two-way telescope, basically looking from markets to science and science to markets. I now think it's more like we need to be looking at it through the eyes of a bee, where you've got multiple lenses looking in many different directions within the university, looking for ways that my science can be paired with other science where 1 + 1 isn't 2, but rather is 4, where my discoveries can be expedited in terms of making a difference, even in the accumulation of knowledge. There's a lot of discussion and attention being paid right now to big data. And rightly so, we now have technological capabilities, computing capabilities, and analytical capabilities, data mining capabilities that we didn't have in the past. So we can ask questions now that would just been impractical to answer in even 10 years ago. But we're able to ask those questions now and draw conclusions that hopefully will allow us to, again, live better lives.
While there are inherent opportunities for us and inherent benefits for the school and for any university to be involved in enterprise development, it would seem that there would be some risk inherent as well, that any enterprise has both benefits and risk associated with it. What are the risks that you think about when trying to decide if an enterprise development proposal or activity makes sense for our school?
Well, obviously, are there conflicts of interest, which there can be? And if so, how do you manage those? It's not do you do it or not, but how do you manage those conflicts? And that's always a legitimate first question to ask in the situations that we're in. The other thing that is a reality is no matter how hard one wants to do it, often academics do not speak the language of business, and business does not speak the language of academics. And so it's almost like there's a translator needed. At Applied Health Science, we had lots of different disciplines who came together into project teams to work on developing solutions. So there would be physicians and nurses, but they'd be working with engineers, they'd be working with coders, they would be working with database specialists. So the project team would be brought together depending on what skills were needed and what experiences. The reality was they knew how to talk to each other. They literally didn't speak the same language. So we had to develop something called layered project mapping to even have a technology that provided us the support to have people from these disparate disciplines to talk to each other so that we didn't have a Tower of Babel being built there. Similarly, in academic settings, we have incredible talent, incredible intelligence, and I think, frankly, we've under-leveraged it in a lot of cases. One of the answers, I think, is basically to have people who can speak can play the role of the translator, can actually not throw a person who is a scientist necessarily out to talk to a business about going to market with what their discovery is. That simply is not a very practical and rational way of approaching things. You would never do that in business. You would never assign a coder to go out and try to develop a new market. By definition, they almost have a different skill set, a different personality. I had people at Applied Health Science, frankly, that were some of the smartest people I've ever worked with. You really couldn't turn them loose with another human being very well, though.
So we've had a really nice discussion here today about the concept of enterprise development, and I really appreciate your insights on that. But now kind of coming back to the school, what are some examples of initiatives or an example of an initiative of enterprise development that we've been engaged in recently as a school? And what do you see as some of the opportunities out there for the school to take the expertise that it currently has and to reach out and develop new types of enterprises as a result of that talent and that expertise?
We have a program called Eat Right by UAB. It was developed out of our school, research in our school, and was formalized into a formal program for people who were attempting to manage their weight. In a lot of cases, they were manage obesity, as a matter of fact. The program was systematized. The intellectual property was developed around that program in terms of specific protocols and routines. It was packaged, if you will, and offered as a service. That service has grown. New clinics have been established in other parts of town. We've been approached by other institutions about using the same model. There are hospitals in the state of Alabama who are using the program. And now we're getting to the point where we're in discussions about expanding the programs very seriously. We're taking a specific look at the possibility of that program being trialed by the military for families of people who are serving in the military. The way that would work is that we would do a pilot or a demonstration project, depending on how one wants to frame it, in a base or two bases, and then scale that into a tailored system for the military where it could be offered on other bases. And that's an example where a program that grew out of essentially basic science was translated into applied research, translated into a service system delivered to the public, and it has been making a difference in a lot of people's lives for quite a long time now. And we're now getting it to the point where we're trying to scale it so it can be offered on a much broader basis. So that would be an example of one that we have a serious, obvious focus in obesity, in diabetes and related diseases, cancer and related diseases to obesity. In our school, we're the only school with NIH-funded nutritional obesity research center, as well as a diabetes research and training center, and we're the only place in the U.S. where that exists under one roof. So that's a big thematic area of ours. Another area that we are really ramping up very fast is the focus on rehabilitation, particularly as it relates to persons with disability. And here's another example where things begin to intersect and researchers can come together and if we expand our notion of what rehabilitation is to say that we're going to broaden that to include rehabilitation of people who have been treated for cancer, not rehabilitation from cancer, but the treatment and the debilitative effects that occur as people go through treatment, then you can begin to see how the logical relationship between obesity, diabetes, cancer, and rehabilitation start tying people together into project teams that work on systems and delivery systems that make it even stronger. We're also, frankly, a world leader in training management and health service administration. We do that in several different ways, and we do it internationally. So again, the whole notion, and we were talking about the enterprise earlier, we are training people systematically to be leaders of health enterprises, and that's a large thematic area. And then we have, in terms of our educational focus, we had said earlier that we were tailoring solutions for specific niches where there is a need. Biotechnology, for example, we're beginning to train what may turn into one of the premier workforce training sites in the world for biotechnology. But we are also looking at other areas, and we're tailoring educational solutions for those areas. So again, the enterprise and the way that we approach that begins to take on a very specific thematic kinds of emphases. One of the biggest threats, we haven't talked about threats, what could threaten us to an enterprise is a lack of focus. And that's something that we're doing increasingly, is spending more and more time focusing on certain areas and saying, this is what we excel at, this is what we're good at, and this is where we've got capacity, this is where we have expertise. And when capacity and expertise meets a need in the market, then you've got something that's pretty special.
Once again, Patrick, thank you so much for joining us today and sharing us your expertise in talking to us about enterprise development and the impact that can have on our School of Health Professions here at UAB.
It's been my pleasure.
If you want to learn more about the various types of initiatives and programs within our school that serve as the basis for the type of enterprise development we just discussed, please feel free to visit our website at www.uab.edu/SHP. And while you're there, be sure to learn about our other programs and our other research projects in which our faculty are engaged. Once again, thank you for joining us. I'm Harold Jones, Dean of the UAB School of Health Professions, where we're shaping the future of healthcare through tailoring innovative solutions to real-world problems.